And we're back! So I apologize for the long wait it took to get this video out, but unfortunately I got sick with COVID and had to take a couple weeks off. But now I'm good to go, so let's jump right back into where we left off. My name is Zach, and this is Paramedic Zach. So thank you for joining me. It's good to be back doing these videos, and we're going to start with where we left off on question 61. When giving an IM medication, in order to ensure that you do not mistakenly administer the medication into a vessel, you must blank. So when giving an intramuscular or IM medication, you want to make sure that you're not delivering that medication into a blood vessel, such as a vein or an artery. The reason being is that typically the dose for an intramuscular medication is going to be significantly higher than that of an IV medication, or the concentration is going to be greater. In order to ensure that you don't deliver your medication into a blood vessel, you need to aspirate for blood. This is done by pulling back on the syringe while the needle is in the injection site. If you get blood back, you're going to want to move the injection to another site. Due to the lessened bioavailability of intramuscular medications, the dose or concentration needs to be higher. If you give that dose into a vein or artery, you're going to potentially overdose your patient. Moving on to question 62. What is the substance that reduces surface tension within the alveoli? The answer here is going to be the surfactant. The surfactant is a thin liquid that coats the alveoli and creates enough surface tension to prevent the alveoli from collapsing. Moving on to question 63. Name the contraindications for starting an intraosseous line. Hint: 4 plus 2 conditions. So the hint is here to pretty much say that 2 of the contraindications are diagnosed conditions, and there are an additional 4 things that contraindicate an IO. The 2 conditions are osteoporosis and osteogenesis imperfecta, and the additional 4 criteria that contraindicate an IO are a fracture in the same extremity, previous attempts in the same bone, an infection of the insertion site, or a burn at the insertion site. Moving on to question 64. A pathologic Q wave is greater than blank the height of the R wave. So a pathologic Q wave is evidence of a previous myocardial infarction. In order to be considered pathologic, the Q wave must be greater than 1/3 the height of the R wave. Moving on to question 65. The ventricles will pace the heart at blank beats per minute if both the SA and AV nodes fail. So a normal adult heart rate is going to be in the range of 60 to 100. This is going to be controlled by the SA node. If the SA node fails, the AV node will kick in and pace the heart at a rate of 40 to 60. Lastly, if all else fails, the ventricles will take over and pace the heart at a rate of 20 to 40. This is known as a ventricular escape rhythm. Moving on to question 66. So what do you suspect? You have a female patient, age 35, with diffuse bilateral low abdominal pain that worsens with walking and intercourse, and there's vaginal discharge, fever and chills, and dysuria. So these symptoms here are going to be indicative of pelvic inflammatory disease. Question 67. What is the equation for calculating the fraction of inspirated oxygen, i.e. your FiO2? Hint: 2, 1, 3. So the hint here includes all the numbers present in the equation. The equation is going to be FiO2 equals 21 plus 3 times the liters per minute. Question 68. Croup is commonly caused by a viral infection and is preceded by cold/flu symptoms, typically in children between the ages of blank to blank. So most commonly, you're going to see croup in children ages 6 months to 3 years old. Question 69. Blank, a syndrome, is caused by excess cortisol production and presents with hyperglycemia, rhabdomyolysis, feeling weak and fatigued, mood swings, and can increase the patient's weight in the shoulders, face, and belly. So these are all signs and symptoms associated with a disorder known as Cushing's syndrome and is a result of excess cortisol production. And last up, we have question 70. Name the condition based on the presentation below. 1. Sitting bolt upright. 2. Drooling due to a sore throat. 3. A hoarse voice. So all these are signs and symptoms pointing to a condition known as epiglottitis, which is an infection causing swelling of the patient's epiglottis. Alright guys, so that is going to do it for this episode. If you want to get these videos regularly and help out my channel quite a bit, make sure you hit the subscribe button below. And if you got any value out of this video, please do me a huge favor and hit the like button. It helps this channel out more than you know. With that being said, thank you guys for joining me and I'll see you next time. Take care.